Hey everyone, and welcome back. Today we're diving into something that could completely transform your health. And no, it's not another fad diet or expensive supplement. We're talking about fasting. Now, before you click away thinking this is extreme, stick with me because the science here is absolutely fascinating. Did you know that there's a specific type of fat in your body, visceral fat, the kind that sits around your organs, that's so inflammatory, it's literally producing molecules that damage your health every single day? And here's the kicker. Regular calorie restriction doesn't target this dangerous fat nearly as effectively as fasting does. Today, we're breaking down why fasting works differently than simple calorie restriction for fat loss, the specific health benefits backed by medical science, different fasting protocols you can actually use, important considerations, especially for women, and practical tips to get started safely. This content is based on insights from medical professionals specializing in metabolic health and cardiovascular medicine. So let's get into it. All right, let's start with the villain of our story, visceral fat. Not all fat is created equal, folks. According to medical experts in metabolic health, when you look at someone with a protruding belly, but relatively normal fat distribution elsewhere, that's a telltale sign of something called hyperinsulinemia, basically too much insulin in the body. And here's what makes this type of fat so dangerous. Visceral fat, that's the fat stored deep in your abdomen, around your liver, pancreas, and other organs, is metabolically active in all the wrong ways. Medical research shows that if you were to biopsy visceral fat versus, say, fat from your buttocks, you'd find two completely different types of tissue. Visceral fat is packed with inflammatory molecules. We're talking about compounds like interleukin-6 and tumor necrosis factor. These aren't just fancy medical terms. They're markers of systemic inflammation that doctors look for in blood tests. This fat is literally producing substances that increase your risk of heart disease, diabetes, and other chronic conditions. And here's something really eye-opening. This fat doesn't just sit around your organs, it's also found around your heart and coronary arteries. Medical imaging like CT scans can now detect inflammation in the fat surrounding your arteries, and this ectopic fat is directly linked to plaque formation and cardiovascular disease. Now, here's where insulin comes in, and this is crucial for understanding why fasting works. Insulin is fundamentally a storage hormone. When insulin levels are high, which happens when we eat, especially carbohydrates, your body is in storage mode. It's putting calories away as fat. For someone with insulin resistance and high baseline insulin levels, this becomes a vicious cycle. They can go on a cruise, come back 5 to 10 pounds heavier because their body is primed to store everything. So the question becomes, how do we break this cycle?
This is where things get really interesting because fasting and calorie restriction are not the same thing, and the difference matters tremendously. Let's talk about calorie restriction first. When you simply reduce your daily calories, let's say you go from 2,000 calories a day to 1,500, your body senses this deficit and your metabolism adapts. Medical literature shows that your metabolic rate actually slows down as a protective mechanism. And here's the problem. Your body starts breaking down everything for energy, including muscle tissue. So yes, you lose fat, but you also lose valuable muscle mass. Now let's contrast that with fasting. When you fast, meaning you abstain from food entirely for a period of time, you trigger a completely different physiological response. Here's what happens, step by step. Hour 1 to 12 of your fast, your body uses stored glucose, called glycogen, from your muscles and liver. You're still running primarily on glucose metabolism. After 12 hours, this is where the magic starts. Your body begins mobilizing fat stores. And critically, the first place your body pulls fat from is visceral fat. That dangerous inflammatory fat we talked about earlier, that's the first to go during fasting. Why does this happen? Because when you're not eating, you're not stimulating your pancreas to produce insulin. Your insulin levels drop significantly. And remember, insulin is a storage hormone. When insulin is low, your body shifts from storage mode to burning mode. The fat gets broken down into free fatty acids, which float into your bloodstream and head to your liver. Your liver then converts these fatty acids into ketones, an alternative fuel source for your body. And here's what makes ketones so special. According to metabolic research, ketones are actually a cleaner fuel source than glucose. When your mitochondria, the energy factories in your cells, burn ketones, they produce fewer reactive oxygen species, which are basically cellular waste products that can damage your body. But it gets even better. Ketones aren't just fuel. They're signaling molecules that trigger beneficial changes throughout your body. Brain-derived neurotrophic factor increases. This is essentially fertilizer for your brain. Medical studies show it improves cognitive function, reflexes, and even visual acuity. From an evolutionary perspective, this makes perfect sense. When you're fasting, nature wants you sharper and more capable so you can successfully hunt or gather food. Growth hormone production spikes. This is huge for maintaining and building muscle mass, which is the exact opposite of what happens with simple calorie restriction. Stem cells mobilize. When you break your fast, you get a surge of stem cells from your bone marrow. Some become immune cells, which is why research shows that people who practice regular fasting tend to have better immunity and get sick less often. But I want to focus on something called progenitor cells, specifically endothelial progenitor cells. These cells repair the lining of your blood vessels. According to vascular medicine research, intermittent fasting increases the production of these cells, meaning your cardiovascular system is constantly repairing itself from daily damage. And then there's autophagy, probably one of the most exciting discoveries in recent years. When you're fasting, your cells sense that no new nutrients are coming in, so they start recycling. They break down old dysfunctional organelles, the little structures inside cells. They package them up and export them. It's like spring cleaning for your cells. Your mitochondria get refreshed and become more efficient, which is why people report feeling more energetic after completing a fast. Here's a real-world example from medical practice. One case documented a woman who completed a medically supervised 72-day fast. She was dealing with obesity, diabetes, hypertension, high cholesterol, and joint problems. The results? Her diabetes resolved, blood pressure normalized, and she lost between 55 and 60 pounds. But here's what's remarkable. Unlike weight loss from calorie restriction, her skin actually retracted naturally. She didn't end up with excess hanging skin that would require surgical removal. This demonstrates that fasting triggers different physiological processes than simple weight loss. Another documented case involved a 183-day supervised fast where someone went from 400 pounds to 210 pounds, and again, didn't have the typical appearance of massive weight loss with excess skin. Important note here, these are extreme cases under medical supervision. We're sharing them to illustrate the physiology, not to recommend this for everyone.
Okay, so now you understand why fasting works. Let's talk about how to do it practically and safely. The beautiful thing about fasting is there's no one-size-fits-all approach. Different goals require different protocols. For beginners, or those just looking to reduce visceral fat, start with the 12-12 protocol. That means 12 hours of fasting, 12 hours of eating. For most people, this might look like finishing dinner by 7 p.m. and not eating again until 7 a.m. During your fasting window, you can have water, black coffee, green tea, or black tea, anything with 0 calories. Medical protocols typically recommend starting here for 2 to 3 weeks to let your body adapt. Next level, 18-6. This means 18 hours fasting, 6 hours eating. You might finish dinner at 6 p.m. and not eat again until noon the next day. This is where you really start seeing benefits in terms of ketone production and fat burning. For more significant weight loss or metabolic issues like diabetes, medical protocols might include a 48-hour fast once per week, or a 3-day water fast every 9 days, combined with OMAD, that's 1 meal a day, on the other days. What about longer fasts?
As mentioned earlier, there are documented cases of extended fasts lasting 72 days or even longer, but these are only done under strict medical supervision with specific health goals. During extended fasts, the protocol typically includes water, black coffee or black tea, daily electrolytes, either a specialized electrolyte supplement or Celtic salt, about half a teaspoon in water once daily, MCT oil if cravings become intense. A teaspoon in water can help. Timing your exercise. Here's a pro tip from metabolic medicine. If you're going to break your fast at 6 p.m., exercise at around 4 p.m., near the peak of your fast when growth hormone levels are highest. Research suggests this timing helps build and retain muscle mass even while fasting. What about resistance training versus cardio? For fasted exercise, resistance training and high-intensity interval training, or HIIT, work best. These don't deplete glucose the same way long-duration cardio does. Short, intense bursts followed by rest periods are ideal. If you're doing long-duration aerobic exercise like running for 40 minutes, that's where you might want to have some fuel, especially for women. Which brings us to an important point.
Let's address the elephant in the room. Does fasting work differently for women? This is one of the most common questions in clinical practice, and here's what medical experience shows. Most women handle fasting protocols just fine. The physiology we've discussed, insulin reduction, ketone production, autophagy, all of this applies to women too. However, there are important exceptions. Women who are pregnant or actively trying to conceive should not fast. The female hypothalamus is more sensitive to energy availability because it's designed to protect reproductive function. If your body senses insufficient energy, it can shut down the menstrual cycle as a protective mechanism. Regarding exercise while fasted, some research in women's physiology suggests that the female body may be more prone to breaking down muscle during fasted aerobic exercise, particularly long-duration cardio. The theory is that women's bodies are more conservative with energy use to protect reproductive function. However, clinical experience shows that women do extremely well with resistance training while fasted, high-intensity interval training, HIIT, while fasted, shorter duration, higher intensity workouts. The key is the type of exercise. Intense muscle work followed by rest doesn't create the same glucose depletion issue as sustained aerobic activity. Real-world results. Medical practice has successfully implemented fasting protocols in women with results comparable to men. The 72-day supervised fast mentioned earlier, that was a female patient with excellent results. The bottom line, women can benefit tremendously from fasting, but should be mindful of their menstrual cycle, energy levels, and the type of exercise they're doing while fasted. Here's an important question. If ketosis and fasting have all these amazing benefits, why not just stay in that state permanently? The answer is that's not how human physiology evolved to work. Think of it this way. You have a checking account and a savings account for energy. Your checking account is glucose metabolism, quick, readily available energy. Your savings account is fat metabolism and ketones, stored energy for times when food is scarce. From an evolutionary perspective, humans alternated between periods of feasting and fasting. We'd eat when food was available, store some as fat, then tap into those reserves when food was scarce. This cycling between metabolic states is what our bodies are designed for. If you stayed in ketosis constantly, you'd just be burning fat continuously, and according to metabolic medicine, that's not optimal long-term. The recommended approach? For someone trying to lose significant weight, say 70 pounds, stay in ketosis until you reach your goal. Then transition to time-restricted feeding, like 18 to 6, which still produces some ketones and provides benefits. For healthy individuals at a good weight, the recommendation is to incorporate fasting regularly, but not constantly. For example, daily time-restricted eating, like 16 to 8 or 18 to 6, one 36-hour fast per month. This gives you the benefits of both metabolic states, the muscle-building, energy storage benefits of fed states, and the cleaning, repairing, anti-inflammatory benefits of fasted states. Remember, the goal isn't to live in one metabolic state permanently, but to give your body access to both states regularly, as nature intended.
All right, let's wrap up with some practical advice if you want to try this. 1. Start slowly. Begin with 12-12, get comfortable, then progress to 16-8 or 18-6 over several weeks. Stay hydrated. Water is your best friend during fasting windows. Black coffee and tea are allowed. No cream, no sugar. These break your fast by triggering insulin. Don't fear hunger. The initial hunger pangs usually pass after 15 to 20 minutes. Your body is just used to eating at certain times. Break your fast wisely. Don't binge. Start with something moderate and nutritious. Track how you feel. Energy levels, mental clarity, sleep quality. Pay attention to your body's signals. Consider medical supervision if you have any health conditions, take medications, or want to do extended fasts beyond 24 hours.
So let's recap what we've learned today. Fasting works differently than calorie restriction by lowering insulin and specifically targeting dangerous visceral fat. It triggers beneficial processes like ketone production, autophagy, stem cell mobilization, and growth hormone release. There are multiple protocols you can use depending on your goals, from simple 12-12 for beginners to more advanced approaches. And yes, women can absolutely benefit from fasting with some mindful considerations. The key takeaway? Fasting isn't a punishment or deprivation. It's actually returning to a physiological state humans are designed for, one that promotes healing, repair, and metabolic health. Before you go, I want to hear from you. Have you tried any form of fasting? What was your experience? Drop a comment below and let's get a conversation going. And hey, if you found this valuable, smash that subscribe button and share this with someone who's struggling with weight or metabolic health. Knowledge is power, and this information could genuinely change someone's life. Critical medical disclaimer. The information provided in this video is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before starting any fasting protocol, changing your diet, or beginning a new exercise program, especially if you have pre-existing health conditions, take medications, are pregnant, breastfeeding, or trying to conceive. Extended fasts should only be attempted under direct medical supervision. Individual results may vary, and what works for one person may not be appropriate for another. Never disregard professional medical advice or delay seeking it because of information you've seen in this video. Thanks for listening, everyone. Until next time, stay healthy, stay curious, and remember, your body is designed for more than you think.